As blood moves through the circulatory system, it puts pressure on the walls of blood vessels. Blood pressure is the amount of force put on blood vessels. It is caused by the blood flow generated by the heart as it pumps and the resistance that blood encounters as it moves through the enclosed vessel. When the heart contracts, blood is pushed out into the arteries. This force pushes against the vessel wall, making blood flow faster under high pressure. When the ventricles relax, the vessel walls push back and blood flow slows down, resulting in lower pressure. The constant pumping of the heart maintains blood pressure and supply throughout the body.
Blood pressure is used as a measure of normal cardiovascular function. The point of highest pressure, when the ventricles are contracting and the pressure is highest in the arteries, is called systolic pressure. The point of lowest pressure, when the ventricles are relaxed and the semilunar valves are closed, is called diastolic pressure. Blood pressure is commonly recorded by measuring both systolic and diastolic pressures. The average systolic pressure is 120 millimeters of mercury. The average diastolic pressure is 70 to 80 millimeters of mercury. Hypertension is chronic or intermittent high blood pressure. Primary or essential hypertension can arise from a combination of factors, possibly related to genetics, diet, and lifestyle that lead to an increase in vessel resistance, cardiac output, or both. Secondary hypertension results from another disorder, such as kidney disease. Struggling kidneys may reabsorb more sodium and water, increasing blood volume and cardiac output, and they may trigger vasoconstriction. Prolonged hypertension increases cardiac workload and myocardial demand. This can lead to ventricular hypertrophy and eventual overload and heart failure. Hypertension can also damage blood vessels, leading to complications such as kidney damage, vision trouble, and stroke.
Normal heart muscle contractions move blood to the body and lungs. Weakened heart muscle can lead to rapid heart rate, fluid in the lungs, a thickening heart wall, and swelling of the lower limbs, symptoms often associated with congestive heart failure.
Coronary develops atherosclerosis acute interior of arteries. Arteries decreasingly blood, compromising oxygen blood to heart. Normally be 2 times some 8 rates called yes. Heart rate that, but when the trial ring rate of normalness occur, via 1 minute car beats per minute, reduced volume, lower output. Circuits form. Are called obstruction to let electron like heart box and cause and contracting put arrhythms hypo cardiac. Mitral valve is one of the 4 heart valves. It controls proper blood flow from the left atrium into the left ventricle. In mitral valve prolapse, the valve bulges inward, does not close properly, and may cause blood to leak back into the atrium. This condition is called mitral valve regurgitation.
Oxygenated blood is pumped out of the left ventricle, through the aortic valve, and into the aorta. If the leaflets of the aortic valve calcify and do not open fully, normal blood flow out of the heart is obstructed and decreases. This is known as aortic stenosis.
called low-density lipoproteins, or LDLs, which transport cholesterol through the bloodstream. These particles can accumulate on the inner walls of arteries, creating lesions known as atherosclerotic plaques. As the plaque grows, normal blood flow through the artery is increasingly obstructed. A healthy heart can expand and contract freely within the pericardium. But when the pericardial cavity fills with fluid from trauma or infection, cardiac tamponade can occur. As fluid accumulates, it presses inward on the heart and prevents the chambers from dilating fully. Less blood fills the heart and contractions weaken, resulting in reduced stroke volume. The more fluid builds up, the more cardiac output falls, and the patient experiences hypotension. Meanwhile, blood backs up into the vena cava, causing elevated venous pressure and a bulging jugular vein. The pericardial fluid also muffles heart sounds. Acute cardiac tamponade can lead to cardiogenic shock and death if left untreated.
Blood is pumped out of the left ventricle of the heart and through the aorta to many body regions. The aorta is the largest artery. A weakening of the vessel wall in the area of the abdomen can be diagnosed as an abdominal aortic aneurysm. A bulge develops, and as the wall weakens further, a rupture that causes internal bleeding results. Oxygenated blood flows through arteries throughout the body. In some cases, the arterial walls in the lower limb harden due to a buildup of plaque. In peripheral vascular disease, the narrowing of arteries leads to decreased blood flow, which can injure nerves and other tissues. The heart sends oxygen-rich blood to the brain via arteries, which branch into smaller arterioles and subsequently to capillaries. Oxygen diffuses out of the capillaries and into the brain. In arteriovenous malformation, the blood vessels are abnormally connected in a tangle, disrupting normal blood flow to the brain.
Heart attack is when blood flow tissue is obstructed. This can occur buildup of plaque artery wall. Oxygenated cannot get rid of the heart that muscle is or is and becomes weak.